let me introduce Dr. Jason Fleming. He is our ER medical director, and he also oversees all of the physicians that work in our ER and in our urgent care. And he's just a big part of our leadership team and on our medical staff, and we work very, very closely with him. So we're really pleased that he's here. I know he's gonna provide great information for you. So with that, let me pass it on to Jason.
So I thought I would begin by just introducing myself a little bit. It's not common, I think, in this day and age for folks to just get some time with a doctor. I mean, the pressures on our lives professionally are so great now, right? You can, even your own doctor, like when was the last time you just got the chance to sit down and talk with them about, I mean, it's tough, right? You're supposed to see a new patient every 12 minutes or something. And so I thought I would just start introducing myself a little bit. And then everybody else could tell their life story, and then then it would be 4 hours from now. No, I'll just tell you who I am first. I was born and raised in Honolulu, Hawaii, at the old Kaiser Hospital down in Waikiki that they blew up on Magnum PI, if you remember that episode. I grew up in Lower Manoa, Makiki area by Punahou School, and went to that school from kindergarten through 12th grade on scholarship. So my hardworking parents were very grateful that the school gave us help. That meant that I would go over there early and have a job, or I would scoop the dough for the muffins in the morning to bake that, or work in the office or something like that, just to help kind of offset the costs. And then after Punahou, I went to Dartmouth College in New England. Everybody in New England wants to go to Hawaii, but if you're from Hawaii, where do you want to go? So I went there, and then came back and went to medical school here at the University of Hawaii. And when you get into medical school, you don't have to declare what specialty you're going into for quite some time. I think that's by design. They want doctors to try out a lot of different things to make sure that they're making the right choice, because it's tough to unmake that choice. So you want young people to choose the right specialty, because it can be a big consequence if you try to change specialties. And I tell the medical students that there's a couple of ways to make that choice. One way is you fall in love with something, because if you fall in love with it, you better marry it, The other way is you don't fall in love with anything, and then you can use your massive brain to make a great choice and disentangle this puzzle that you've fallen into by going to medical school. And in my case, I fell in love with emergency medicine. I thought that if I chose any of these other medical specialties, which I really enjoyed as a medical student, if I chose, OBGYN, what a great specialty. You get to deliver babies, you get to do some surgery, some primary care, people are generally happy. That would be great. Or pediatrics. I love children, I love families, I love watching people grow up over their lives. Or even surgery, being able to reach in and actually fix a problem. I love that. But in the end, if I'd chosen any of those other things, then every day I came to this hospital, I would look over at that big red sign that says emergency, and those glass doors, and the ambulances backed up, and all the action that's going on in there. And I would think, some lucky bugger gets to work in there, and I blew it. So I was in love with it, and went to New England again to train at the University of Massachusetts in emergency medicine, where I was chief resident and a flight physician. They gave me a flight suit. I got to go in a helicopter and fly around Boston and New England and transport patients. And then, when I finished residency in 2005, I came back to Honolulu right away. Worked at Queens Medical Center in the ER for 2 years, doing trauma and all that stuff. Worked at Kapiolani and Palimomi Emergency Department for 8 years. And then in 2014, they offered me the job of the medical director here at the emergency department at Kuakini, and I took it. And I have been so happy to be here. I think Kuakini is such a special place, some of which I may communicate to you today, but I truly believe it is unique in all of Hawaii now. It's the last independent hospital in the state of Hawaii. It tries to deliver a kind of health care that you don't get anyplace else anymore. And it has been a great place that's supportive of me and other independent doctors who have a vision of trying to deliver health care to people of Hawaii that we believe they deserve, without a lot of the other mess that goes along with kind of corporate medicine these days. Last year, I was talking with Kuakini administration about their idea to open an urgent care on the Kuakini campus. And I was very fortunate that they partnered with me and our physician group to stand that up. And so in June, we opened the doors of the urgent care here at Kuakini. So I run the emergency department, and I run another group, which is the urgent care group. And that's really why I'm here today, to talk to you guys about that, maybe to give you some facts about emergency departments and urgent cares, maybe to give you some insight into why you would choose one over the other in any given situation, what the capabilities are at the urgent care versus the capabilities at the emergency department, what to expect when you go there. Of course, if you want to talk about growing up in Hawaii, I could talk about that too, or where the best shave ice place is, or how come Hungry Lion closed around the corner, or all of those things. I can talk about that too. But I think the reason why Gregg asked me to come here is to talk about the urgent care and the emergency department. So I figure what we would do is I'll give you some information about those things, okay? And then I've done these kinds of events several times before with similar kinds of crowds of folks. I've found over the years that there's a lot of value in holding out time for questions and interacting with the audience, because raise your hand if you have ever interacted in any way with an emergency department or an urgent care in your life. Right, so put your hands down. So everybody here has some experience with what we're talking about, right? And I'm going to tell you what the vision is, what the mission of these things are, but everyone has a story to tell about how that has affected you, or what experience you had, or what questions came up when you were in that role. So I want to hold out some time and space for that. And then, people have already started taking selfies with me, so if you want to do that later and you have your cameras, we could do that. If you want to take selfies without me, that's perfectly fine also. I prefer that, but that's okay. Yeah. Let me talk a little bit about urgent cares and emergency departments. Emergency departments, okay, so it used to be, decades ago, maybe in the 1950s and 60s, that a hospital had a front door, and people would just show up at the front door for unscheduled visits because they were having an emergency. And so hospitals would figure out how to solve that problem by maybe putting a nurse over there to figure out what the problem was, and they would call a resident doctor to come down and see if they could help. And it was rather disorganized, and it was a puzzle that each hospital individually had to solve. And in the 1970s, the demand for emergency departments was growing. So hospitals began to build dedicated areas to intake patients who needed their help today, right now. And in the late 1970s, it became obvious that this was really its own medical specialty, that it couldn't be handled just by an internal medicine doctor or a general surgeon who happened to be awake, and that there was enough of a unique skill set that nationally they declared that emergency medicine was its own specialty, developed its own training programs, its own residencies. And so emergency physicians are specialists. They're specialized in how to handle an emergency department. And we take care of anyone for anything at any time, at least for a few minutes. And part of our job is to quickly identify what's going on, to investigate aggressively for the presence of an emergency medical condition, and then figure out whatever resources are necessary and bring those to bear on that emergency. That's what emergency departments do. That's what emergency physicians do. An emergency department is really a tool, okay? Humans are tool-using creatures, and an emergency department is a huge, complicated tool. And what that tool is designed to do is to identify and treat emergencies. It's not that good at some other things. It's not that good at managing chronic problems over a long period of time. Like emergency departments are not super good at adjusting your blood pressure medicine or managing your cholesterol. Or, I've seen 16 different doctors for my chronic back pain. I'm relatively dissatisfied with everything so far. We try to help in those situations. I mean, we earnestly do. But what we're really good at doing is when you're worried that something dangerous is happening right now, you're in pain that you've never been in before, you have a symptom that's concerning, like you can't breathe, or you're having chest pain, or abdominal pain, or vomiting all the time. Something is happening now. We're not sure why, and you need treatment and relief for it right now. That's what the emergency department is for. And because it is typically attached to a hospital, the emergency department is the front door to getting emergency treatment in that hospital, right? So if what you need is an orthopedic surgeon because you've got a broken bone that's poking out of, then we call that orthopedic surgeon and we get an operating room ready and you get that fixed. That's what the emergency department is for. If that indigestion you've been feeling for 3 weeks that gets worse every time you go up the stairs and you begin sweating and feeling short of breath, and we realize, hey, that's probably a heart attack that's coming on, then the emergency department is the place where you get that identified and you go up to a cardiac catheterization lab, which we have here at Kuakini, and we fix that heart attack and save your life. That's what the ER does. But because it's designed to do that, there are some limitations, right? We have an obligation to turn our attention to the most critical, serious, urgent problem, whatever it is. So, even though if it's busy, you can kind of take a number and wait your turn, sometimes we take other people before you, even if you've showed up before them. The reason is because there's something about those other people and their presentation that is so concerning that we have to respond to our duty to take the sickest people first, and then the emergency department has to turn its attention to those things, right? So that's frustrating, especially if your toe pain is super bad today. And so what do if your toe pain is super bad and you don't want to wait 3 hours or 4 hours in an emergency department? Although I will tell you that the Kuakini ER is the fastest ER in town. Because our door to physician time is under 30 minutes here at Kuakini in the ER, which is way better than everybody else. I've heard a lot of stories about some of the other hospitals, some of which I worked at, where people wait 3 hours to see the doctor. Here, it's a lot faster. But let's say that you have toe pain, it's super bad, and you don't want to wait that long in the ER, and whatever, the environment is chaotic, that's not what you want. Then that's the kind of thing where people might consider going to an urgent care. So what's an urgent care? An urgent care is typically a medical provider. In this town, sometimes it can be a nurse practitioner, but many times it's a physician. At Kuakini, it's pretty much always a physician. You need to see a doctor now, today, but it's not really like you're dying, but there's a whole lot of things that could happen where you need to see a doctor today and you don't necessarily feel like it's a threat to your life. That's what the urgent care is for. So there's a doctor or a medical provider, there's some medical assistants, it's like a doctor's office, but it's designed for unscheduled appointments, and it's designed in some way to figure out what's going on today and then do their best to help you with that. So, some examples of things that an urgent care typically can do pretty well is you've got a cut that needs evaluation or needs to be repaired, like sutures. Yeah, we could do that. You've twisted your ankle. You need to know whether there's a broken bone or not. Yeah, we can do that. Some urgent cares have an X-ray machine in that urgent care. Some have an X-ray machine that's like right around the corner, like ours. I mean, we're right here on the hospital campus, so you can get an X-ray here, you can get lab tests done. Again, we're not like super designed to do chronic management of medical problems like your cholesterol and do I need to adjust my blood pressure medicine. That's not as much what an urgent care does. And the primary care doctors don't want us to do that, right? They would prefer to manage that, which is better care because they know you best and they know all the interactions, right? But, hey, I'm sick now. Do I need antibiotics or not? I injured my ankle or my knee. Do I need an X-ray or not? What should I do about it? What kind of medicines do I need? Those are classic kind of scenarios that an urgent care makes a whole lot of sense. And so in their wisdom, the Kuakini administration realized a few things a couple of years ago. One, there's hardly any urgent care access in this area, right? You can either go to Kaka'ako or you can go out to Aiea, but there isn't anything kind of here. So that's the first thing. The community needs it. Second thing is that the independent physicians in Honolulu needed it. They needed it because they need a place that's cooperative, that they can send their patients if they're busy. Like if you call your doctor and you're like, I'm sick today, I mean, half the time you're going to get told what? Oh, I can't see you today, right? And that's not their fault. That's the big forces in healthcare that are putting pressure on those offices. They have to pack their schedule from 7:30 in the morning until 6 at night, and then their building closes, and then they have to shut down. They can't even stay open late nowadays. So they'll say, gosh, I can't fit you in. So we wanted to support those practices with access that's friendly, that's cooperative, that can share information, that can coordinate things, that can help the patients when they can't get to see their primary care doctor. So that's another primary mission of this. It's a great example of how a health system, Kuakini, independent health system, is going out of their way to cooperate with independent physicians, which is really the old style, right? That's the way that it always has worked. It's just that a lot of the complaints that we all feel nowadays about healthcare have to do with how bigger and bigger entities are coming in and controlling more and more of that relationship. And my guess is that almost everybody in this room has felt that in some way in your life, or somebody you love, and you know exactly what I'm talking about. And so just a tip of the hat to Gregg and the Kuakini administration for recognizing that and going all in to help the community in this way. I'll share this with you, that the physicians in this town are starting to see more and more that Kuakini is a lifeboat for doctors that really want to practice medicine in that way, and are starting to see how difficult it is outside of that environment. So I'm interested to hear from some of you. Like, if you have a question about this, if what I've said has triggered something that some story from your experience, or you just want to know more about something, then I want to hear it. So who would like to, I'll just open it up. So the question is a personal one. It's about a surgery that he's had. He's got a device implanted. He has some kind of, bothersome, annoying, complication from the procedure, but some effects of that. In this case, it's uncomfortable. And he's asking, have we ever had experience with that sort of thing? And the answer is yes. I mean, we don't pre-screen our patients when they come in. So whether it's the emergency department or the urgent care, the doors are open. And our attitude on the part of the physician group, and I think all of the staff that work there, is that it's not your job to know always whether what you're experiencing is an emergency or just an urgent care thing or something that should wait until tomorrow or whatever. It's your job to notice that something is wrong and to have the courage to ask for help. And so if you come in to the emergency department or the urgent care, then we're going to try to figure out what it is that's going on, always kind of through this lens of, is is what you're experiencing the tip of the iceberg? Is this the beginning of an emergency? Is this evidence of something dangerous that's evolving? Or are we in a category of, it's not really dangerous right now, but it's bothersome, it's annoying, it's painful, whatever it is, and it's a ongoing. We're trying to figure out which category we're in, and then we earnestly do our best to try to help you at least today. So the answer to your question is, yeah, we've seen that kind of stuff. That's kind of how we approach it, is to try to learn about your experience and try to figure out how are we going to be able to help you today with that. And sometimes it's a matter of changing a medicine or giving you a new one today. Sometimes it's a matter of, well, you need a test that'll help us discern what's going on, and then I'll have an answer for you. And sometimes it's giving you a perspective, or sort of talking honestly about what can and can't be done today or in this emergency department, or what the roadmap is going forward. Yeah. Good question. Okay, so Melanie's got this great kind of like a real life question, right? Like, let's imagine you slip and fall in the bathtub. And you're feeling kind of okay. I don't know, maybe you're bumped or bruised a little bit, but how am I feeling? I'm kind of feeling okay. What are you supposed to do? Right? She's asking, like, do I go to the emergency department? Do I go to urgent care? Do I just wait until the next day, call my doctor? It's a great question, right? And it's probably not possible to give you a recipe that's going to work 100% of the time. But I think it's good to bring this up so we can talk about some of the nuances and how we all can make better choices or better decisions about all of that. First thing I would say is, not all falls are the same. Not all patients are the same, right? Some people are on blood thinner medicines. Some people have had certain injuries that they're worried about exacerbating or triggering again, right? So you kind of have to know yourself and your situation and use that as the baseline. And kind of gauging what we call the mechanism of injury, right? Not all slip and falls in the bathtub are the same. Sometimes you slip and fall and you hit your knee. Sometimes you slip and fall and you whack your head super hard, right? So we don't see those two things the same. Those are different scenarios for us. And then, kind of what I was talking about with Vincent's question too, we don't expect our patients to have all of the medical, sophisticated, nuanced understanding of all of that stuff, right? What do we want you to do? We want you to feel like, I recognize something might have happened. I need to get some advice. So even feeling like you're caught in a dilemma about what to do might be a sign that it's worth coming in and getting checked out. Why not? Right? Because we can have a conversation like this and talk about what your symptoms are, what the risks are. A lot of our physicians today engage in what's called shared decision making. So that's very helpful for patients, right? Like, let's lay out what the possibilities are, and then we can vote on what you want, and you get the deciding vote. And then if you have questions, you ask, and then we come up with a solution that fits for you. I never feel bad when somebody has come into the emergency department saying they fell in the bathtub and they wanted to get checked out. I feel better about that, right? Because like Melanie said, we've all heard stories about people that delayed coming in when it could have made all the difference. So that's why what I want for all of you is not necessarily to know all the things that the doctors know and the nurses know, but to know that these resources are here for you, and to realize that the doors are open for you, and you can come in and we will do our best to help disentangle all of that. That's a great question. Yes. She's asking, is the urgent care a one-shot deal where you come in and we help you for that one thing and then we tell you to go see a regular doctor for follow-up? Or do we coordinate with your regular doctor? And the answer is yes. It's both. It's not either or. The doctors in town have cooperated with Kuakini. They're loaded into our system. If they have given us their fax number or their contact number or their email, whatever, the secure communication, we can send the charts from the urgent care directly to them. If they haven't set that up, then they can contact us and we'll load them into our system. But we've reached out to all the folks we can think of to get that done. And the primary care doctors have contacted administration and us and been very grateful generally that they're getting this kind of communication. But the urgent care is not designed to step in the way of your relationship with your primary care doctor. It's really there to support the patients and the primary care doctor to get things done faster, to get things done in a more convenient or efficient way when we can. We're not taking the place of a primary care doctor, though, right? So there are some things that a primary care doctor will do that we don't do. Like we don't do preoperative clearances. You know, like some people are going to have their shoulder done, and they're like, "You got to get cleared by your doctor." Like we don't do that because there's no way for us to know all the things your primary care doctor knows about you and your risk for that surgery and fill out. That's not it. But if you're sick today and you need a question answered, you got injured today and you need that looked at, even if you've run out of your medicines and your doctor is on vacation in Japan taking pictures of the cherry blossoms and there's no way to get it, then you can come in and we'll help you with those kind of things. And then, yeah, we'll make sure you get plugged back in with your primary care doctor. For people that don't have a primary care doctor, we can also serve as a way to try to help you attach to a primary care doctor. So Kuakini has a primary care clinic with Kuakini physicians that are taking new patients. So if you want to be seen by a primary care doctor on the Kuakini campus, then yeah, we have a great office that does that too. And we also have terrific relationships with some of the private doctors, some of whom are taking new patients, and we can help you get plugged in, with a practice that fits for you. Hope that helps. Thank you, Wendy. Yes, sir. Yeah, that's a good question. His question is there a difference in the way the charges are handled for the urgent care and the emergency department? And yeah, there's a little bit of a nuance there. So that's an interesting question. So let me just talk about that for a second. Emergency departments are governed by federal statute, a law called EMTALA, which stands for the Emergency Medical Treatment and Labor Act. And that was an act of Congress that basically says this: anybody who appears at an emergency department can get treatment at that emergency department for an emergency condition until that condition is stabilized. And it also governs some other rules about how patients can be transferred between hospitals and that sort of thing. So what that means is if you go to the emergency department, we're going to take your insurance information, we'll take your demographic information, your phone number, all that, kind of your social security number. They have to get all that stuff to identify you and make sure that your medical record is the right thing. But some of that has to do with contacting your insurance company and handling the payment after the fact. You're going to get treated in the emergency department without having to pay up front. In fact, I don't even know what kind of insurance people have when they walk in the door. Our doctors don't even know that. Right? We're just focused on the clinical scenario and trying to help you disentangle whatever's happening. And then after the fact, that visit, whatever it is, gets run through your insurance plan, or if there's a copay, then they reach out to you to pay. There's 2 different bills that come from an emergency department, in case you're interested. There's a facility charge, and there's the professional fee, because the doctors are not employed by the hospital. That's the way the rules we didn't write those rules, by the way. You don't go into medicine if you're interested in writing rules. It's always the lawyers that write the rules, and then we have to live with it. But that's the way it's all designed. So you get a charge from the doctor for the doctor's stuff, which is separate from the hospital side. And that all happens after the fact. In the urgent care, because the rules are different, there's no law that says you are entitled to getting care up front at an urgent care, a doctor's office, or anything. So just like at any other doctor's office, they're going to want your payment information up front before you get in. So people who don't have insurance can pay out of pocket, and we do have a scale, these days, some people don't have insurance. Probably everybody in this room has insurance. But some younger folks, like in their 20s, will go without insurance because they're just taking the risk and they're just paying out of pocket if they need it. So we have ways to handle all of that stuff. But that's the main difference, right? At the ER, you're going to get 100% of the treatment, and then after the fact, somebody is going to figure out the payment stuff. At the urgent care, there's a little bit more upfront, but we bill insurances after the fact. So that part, if you're covered by Medicare or any of the private insurances, then that's the way that's handled. So I hope that's helpful. It's a little nuanced, but I'm here to speak the truth to you. I'm here to pull back the curtain and show you what's behind it. Okay, so what she's asking is kind of I mean, it's a broad question, but it is also specific to the city of Honolulu, right? There are different urgent cares in this town. Some are independent urgent cares, so it's some doctor that has opened up an office and calling it an urgent care. Some are attached to a bigger system, right? Like Queens Island Urgent Care or Straub or HPH Urgent Care. And then there's this Kuakini one, which, by the way, is unique. And your question really is, let's say your doctors are affiliated with one system. How much are you locked into going to that system's urgent care? So the answer is that you're not locked in. All the urgent cares are open to you. Some of the computer systems are linked within a system, but to the extent that people come to an urgent care for an isolated, acute medical problem, most of the time, we can get, almost all the time, we can get everything we need from a conversation with you. What medicines are you on? What medical problems do you have? What are your allergies? And what's going on today? And that's enough for us to get to the bottom of it. And I think it's an important question too, because I've heard twice in the last week the same kind of story. So a good friend of mine, who's a doctor in this town, her husband is a firefighter, and her husband texts her on a Saturday and says, "Oh, I cut my finger at work," because he's cooking at the fire station, cut his finger. So she goes, "Go to the Kuakini ER. They'll get you in and, the urgent care, they'll get you in and out super fast," because he's at work, right? He's got to get back to the fire station. He's like, nah, they got some policy. They told me I got to stay in my district, because he's over by Kaimaki or something. So he goes to, he goes to a different urgent care. That's on that side, right? One that maybe I've already spoken out loud. So 2.5 hours later, she hasn't heard from him. She texts him, "Hey, how did it go?" And he goes, "I'm still waiting." But, we're pretty fast here. We're focused on it. Because a lot of the people that we have working at that urgent care are emergency physicians. We're used to driving this forward. We get right to the point. We try to fix a problem and get you guys out. And I think that's an advantage in the way that this has been designed with Kuakini, that because we have that bent, we recognize how fast people want this done, right? You don't want to spend all day going there. You want to just get the problem fixed. So that's what we want to. I guess the way I would address that question is, our doors are open. We're happy to help you. If your doctor's affiliated with another healthcare system and you want to go to an urgent care and you want to come to us because we're convenient or we're fast, or you just, we wear nice aloha shirts or whatever it is that you like, or my mom and you want her to be happy, then just come, and then we can send the write-up of what happened to your primary care doctor. It's perfectly fine. The question is about homeless people, which, it's a nuanced cohort of people too, because some of those people have health insurance. Some of them even have primary care doctors or clinics that they're affiliated with, but some do not. I think because of those dynamics, that And what Ben's question was earlier about how that payment is handled, like if people come to an urgent care and don't have insurance or an ability to pay, then they're not obligated to treat them the way that they are at an emergency department. So I think unless something changes on a statute level, the homeless people will continue to access emergency departments for all manner of medical care, whether it's a true emergency or, you know, more of a social, environmental issue. I hope that addresses what you were asking. Are there some urgent cares that are specialty urgent cares? And the answer is yes, right? Because you brought up an example of all access ortho. So all access ortho is an interesting kind of urgent care. Okay, to me, as a kind of a technical guy that lives in this universe of healthcare, it isn't really an urgent care. The way I define an urgent care, and the way probably most people, including insurance companies, define it, is a clinic that will handle unscheduled visits for a wide variety of problems. But you could do what they did, which is narrow everything down to just isolated extremity injuries. And so all access ortho is an interesting thing for me too, because I know the guys that started that originally and why they were doing it, how they structured it. And it turns out it's a great model. I really applaud them for doing that because it solves a need in the community. And so there is a chance. We have started to look at that model and have considered whether there might be some value for the community in having specialty urgent cares or specialty walk-in unscheduled clinics for things like orthopedics. Right now, our urgent care can handle orthopedic injuries also. We are supported by an outstanding independent orthopedic group, one of the big groups on the island. And they have a long relationship with Kuakini and with our patients. Not only Kuakini, but they're a big group. And they've been very supportive of this. So if you come to our urgent care with an isolated extremity injury, which means I twisted my knee or I fell down and hit my ankle or whatever, then when you come to see us, you get evaluated by our doctor, you get x-rays if you need them, you can get splinted or a brace or crutches or whatever you need. You get a referral for outpatient follow-up with the orthopedic practice that we're partnered with. Those guys, we're being told by our patients' feedback, answer the phone right away. They get you the next available appointment, which is sometimes that day or the next day if we're lucky. They've got multiple offices, including Wiley Avenue and POB, right? So this is Island Orthopedics guys. They're fantastic. They operated on my father-in-law twice on both of his hips, and those guys are really fantastic. I mean, just to pull back the curtain a little bit, this might be a little too technical, but you know, it gets me excited because I'm a doctor and I always see this stuff behind the scenes. So it's a quick story about my father-in-law when he broke his hip. Fell down and broke his hip. We brought him to Kuakini. We did the x-ray, he's got a broken hip. I called Jason Kanashige, who is an old friend of mine, orthopedic surgeon. He runs Island Orthopedics. He was the guy on call. He said, no problem, we'll put him on the schedule, we'll fix it tonight. And I was, oh, tonight, that's great. You know, it's only in like an hour. So I told my wife, let's go get something for dinner, we'll come right back. So we go out and we come back, and I'm timing it because the start time is at a certain time, and I'm thinking, you know, like how long surgery is going to take, and then he's going to recover, and right? So we come back, and I go, oh, where is he? And they're like, oh, he's done. He's in the room. What do you mean done? Like his total operating room time was only 45 minutes for a broken hip. Those guys are so fast and efficient, and no complications. And when you think about it from my perspective as a doctor, right, every minute under anesthesia is a risk, right? You don't want, you know, surgeons who don't know what they're doing. You know, what they're taking long. Those guys are so good. Like I credit them with a lot. So I'm thrilled that Kuakini has that relationship with that group. That relationship will be solid forever. And I just adore that whole group and love working with them. So they will help our urgent care patients and our emergency department patients. great group.
So, this is what we opened in June, October. This is our 5th month, but we are beginning to talk about those kinds of things. And in fact, we started to have some just preliminary discussions with Island Orthopedics to see, does it make sense for us to think about maybe in 2026 expanding our urgent care so that we could potentially handle those types of more specialty kind of urgent needs. And fortunate for us, where our urgent care is located, there is space right across. We're currently using it for medical records, but we could easily move those medical records to another space and start to open up that space and then we'll probably put an X-ray machine in that area. And so more to come, but we're still learning this new business called urgent care, but we're definitely already beginning to have discussions around how can we expand it to meet the needs of our community.
Yeah, and I just add a comment about that, right? Because Gregg is an administrator, right? He's in charge of this whole health system, and I'm just a doctor. But what's amazing about Kuakini in this place, to me, truthfully, is that what he's talking about, what we're talking about with this project, what you're watching us talk about in front of you, about this thing that's right at the beginning, this is not a big corporate, money-driven decision that has to do with strategy and trying to wring as many dollars out of the insurance company. It's not that at all, right? I think you're getting the sense. This is physicians who care about their patients. This is our patients and their needs. And this is a health system that is laser-focused on supporting that style of healthcare delivery. And I just feel very fortunate that I get to be a part of it. Okay. Yes. Where is it? Where is this? What are we even talking about? Yeah, it's a great question. I love that question. So the Kuakini Urgent Care is on the ground floor of the Kuakini Physicians Tower. You know which one the Physicians Tower is? Well, it's the tallest building on the campus, but it's the one on that side of the medical center. You know the dome? It's the high-rise that's immediately EVA of the dome. Yes. Correct. Before I started this, I was thinking, I wonder what time it'll be when we start talking about the parking. So thank you for bringing that up before we got to the end of this. Yeah, sorry about the parking. That's not the best thing about that building. But there's free parking for the urgent care. It is right there, so you can kind of get into the parking garage and catch the elevator down. And you can drop off and pick up right in front because the road is a little wider there. So it's really easy. Like we have that. Like folks will come in, pull up to the road, let somebody out, and the door is right there. And then we can get started while you park the car. So that part is, pretty convenient. The parking garage itself, right? There's some architectural, a lot of head shaking. After this, I'll be in the back to give hugs to people who have parked in that parking garage. I apologize. But we are carving out spaces for the urgent care. It's going to be easier than average to come in and out of there. So that's where it is. It's on the ground floor, just outside of the building entrance is the urgent care door. And that space that Gregg is talking about that's immediately across that entrance is where we're intending to expand. So that'll be kind of the home base footprint. And here's another reason why this urgent care is unique in all of Hawaii, as far as I know, okay? The other urgent cares, when you go to Kahala Mall or you go, let's say, going back to these questions earlier about how do we know if we need an urgent care or an emergency department? Well, let's say you choose to go to the urgent care and you go to the one in Kahala Mall. And after waiting for 2.5 hours, you finally see somebody and they tell you, you really got to go to the ER for this because we don't have a CAT scanner, or we don't have a specialist or whatever. Now, you got to decide whether you're going to get back in your car and drive across town and find more parking and do the thing, get to an ER, or are they going to call an ambulance, take me over there from, right? Here, you park in the mediocre parking lot, come to the urgent care. You need to go to the ER. We just take you right around the corner to the ER. We're all in one place. It's the best setup for real. Like if you're not certain, come to see us and we'll help you sort it out and we'll get you pointed in the right direction, save you tons of time, right? Because we'll take you right into the ER and get you started. Yes. The ER is open 24/7. So I would love for the urgent care to be open all the time. That wouldn't break my heart. But we have staffing issues. We have some constraints that are different than an emergency department. So the emergency department is always there if you need us. But the urgent care is like a doctor's office. So there are hours. It does close. The people do go home and buy their kids Jack in the Box and feel like they're bad moms or dads for doing that and eat pizza and read a story and go to bed and then come back the next day and open the thing up and try again to help as many people as we can. But if you show up kind of toward the later side, like let's say you decide at 7:30 you want to come to that urgent care that you've heard is open till 8, what happens then? Well, we were just talking about this the other day, but it's sort of like a restaurant, right? Like if the restaurant is closing at 10 p.m. and you show up at 9:45 and you're like, I'm here to sit down and eat, right? They're going to be like, oh, I'm so sorry, right? There's no way for us to cook your steak and get you dessert and everything by closing time. It's already, so they kind of have like a last seating for restaurants, you know what I mean? So at the urgent care, if you're in the door before 7:30, we typically can, most of the time, get you through the whole process before we have to shut everything down. But if you show up really close to closing, then sometimes we're going to be like, I'm so sorry, like just, it's not that we don't want to see you, it's that we're forecasting how long is the whole encounter going to take for you. And if we're thinking this is going to be an hour and a half to get from start to finish, but we've only got 20 minutes left before we have to close the door, then we might offer you to take you around to the ER where we can at least get things started and get you taken care of that way. Then you don't have to change your parking. Yes. It's her understanding that urgent cares don't handle head injuries. And is that correct? It's a little bit of a nuanced question, so I'm happy to talk about that. The real issue is that most urgent cares do not have access to a CAT scanner. And a CAT scanner is an X-ray machine, a fancy tool that takes three-dimensional X-ray images of your body parts and is the preferred test to determine whether you have bleeding around your brain or a skull fracture. So, the reason it's a nuanced question is because not every person who has a head injury is going to need a CAT scan. And whose job is it to know? Well, it's not your job, right? Your job is to be worried enough to come in. It's our job to know. So, again, pulling back the curtain to how physicians think, there are guidelines that are published, decision rules, criteria that we, are evidence-based that we follow about whether this person in front of me needs a CAT scan or not, based on their age, what medicines they're on, their other medical problems, the mechanism of injury, blah, 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 all that stuff, right? Because you can imagine that, a 13-year-old who fell off of a climbing jungle gym and hit their head, but is otherwise fine and has a lump on their head, that's a totally different scenario than a 90-year-old who fell down at home and maybe is a little sleepier than usual and is on a blood thinner medicine. You know what I mean? That they're different. You can see that those are different scenarios. So those are the kind of thought processes that the doctors go through when they see somebody with a head injury. And so sometimes the head injury is something fell off the shelf and cut my head. But otherwise, I'm neurologically fine. We can handle that in the urgent care. Sure, we could sew up that cut. We could evaluate you. We could see, yeah, there's no signs of concussion. We'll give you some reassurance, tell you what to watch out for. But if we feel like you need a CAT scan, then you are typically going to have to go to the emergency department. I'm going to turn it back over to Gregg to say any closing words to all of you. And I thank you so much for coming to this. I've had a great time talking with all of you. Come to see us at the urgent care.
Thank you, Dr. Jason Fleming. What a great talk. This doesn't happen by itself. It takes a lot of people. Donda and Mel from our marketing PR department are the primary people. But then this is also, these health seminars is really a partnership with Japanese Women's Society Foundation that provided, some of the snacks, and then our auxiliary, our Kuakini auxiliary that makes up all of the volunteers that work here at Kuakini. So just wanted to thank them for putting all this together for us. Thank you. Thank you very much for coming today, and have a great weekend.